Hi, I'm nursing student Jason. Today I'm going to be doing your trach care. Somebody left the bed up, but this is actually a good working height for me. So I'll just leave it right there. Don't move around. I don't want you falling off. So I'm going to put this imaginary SpO2 monitor on your finger, and that'll also get your heart rate. And then I'm going to listen to your lung sounds, and I'm also going to get your respiration rate. And I want to, after I get all that, I'll make sure that you've got more oxygen, because I'm going to be moving your oxygen away from you, and I don't want you to become too deoxygenated. Now I'm going to, if I could, I'm going to do some hand hygiene. Now, is all that okay with you? But before I really get started, what's your name and date of birth? Okay, correct. All right, I'll be right back. I'm only following the doctor's orders, so I did look at the doctor's orders. And hand hygiene, some hand sanitizer. I'm gonna put on some gloves that just came off the wall. Go ahead. I'll get, while I'm thinking about it, I would get a fresh alcohol wipe and clean that, throw that away. All right, and if you could, I'm going to put this right to your skin. So take a deep breath. Thank you. And take a deep breath. All right, and another. And another. And another. And another. And one more over here. And one more over here. Thank you. All right. Your lung sounds are pretty good. So now I'm going to perform your trach care, but before I go ahead and do that, I'm going to take off my gloves, and I've got a towel for you that I'm going to put on your chest, just so I keep your shirt nice and clean. I'll put that right there like so. All right, I'm going to do some hand hygiene, sterilize my hands. I'm going to open this up, which is make sure it's not expired or anything. I'll bring this a little bit closer, and I'll be using the sterile water. I want to get I've got some sets of sterile gloves, and I want to get my sterile field. I want to make sure that I'm not touching anything inside the 1-inch border, and if I do touch anything inside the 1-inch border, let it be the shiny side, because that's the back side. All right, put that down. All right, now I'm going to very gently put this into my sterile field. And then with the label in my hand, my palm side, I'm going to put some water in 2 of these compartments. Okay, I'm going to leave the top off of it. Okay, and now I'm going to put on some sterile gloves, which I've got them over here. I'm going to use this area over here. I'm going to pretend I have actual sterile gloves. I'm going to be using a purple pair of clean gloves, but they are arranged so that you can think that they're sterile. This is not cooperating. All right, so I'm going to go Not touching the outside of the glove, and touching the inside as it is folded over the cuff. All right, so now what I want to do, I'm going to take your cannula here and take this off and make sure it's a non-fenestrated cannula. Going to let that soak for a moment, and then I'm going to make sure that that's back on you. And I want to I'm going to perform care on your cannula over here. So I'm going to monitor, make sure you're breathing okay. Are you still breathing all right? Sounds good. All right, so now I'm going to take this and clean out my tube. And I'll clean that until it's all the mucus and everything is off of it and it's nice and clean. All right, and then I'll put that in a area that doesn't have water in it, and then I'm going to rinse it with the label in my hand. Okay, I'll put that right there. That's why I needed to keep the cap off. All right, and now I'm going to put this back in and making sure that it snaps in place. All right, and replace that. All right, so now I'm going to take this set of gloves off, this set of sterile gloves, and I'm going to chuck these. And now I want to get on another set of sterile gloves, making sure I don't turn my back on my sterile field. And open this up. And I want to get this onto my dominant hand first. Without touching the outside. And I'm going to get this on my other hand here. Without touching the inside of the glove with my dominant hand. Okay, so now I'm going to perform some hygiene. So I'll separate these out. So, all right. So first I'm going to take one pad or gauze and dip it in an area that is not contaminated, and I'll make sure I squeeze it out so it's not totally just crazy. Oh, and I also I want to take this out as well. So I'll have to take that out, and I will be replacing that, so I'll throw that away. But I'm going to use this to clean the plastic as well as possible, and I can turn this around and get another clean swipe. Okay, and now I can chuck that, and then I will take a cotton swab and dip that, and I will clean underneath in a, let's see, so I'll chuck that, cleaning every quadrant away from the actual ostomy or stoma. back on there. Take some deep breaths. I want to make sure that your oxygen levels are staying up. All right, so I throw all those away, and I'm going to take another piece of gauze, and I'm going to use this to pat dry the area. All right, and I'll throw that away as well. And now I'm going to take this new collar, for lack of a better word, and I'm going to put this around your neck. And while the other one is holding it in place, I'm going to put a new one on here so that I'll replace it with the blue side toward you. So I'm going to, let's see, go like so. I'm going to move that out of the way. Wait, I'm not going to detach that just yet. I'm going to slip this underneath. That connected like so. All right, how are you doing? You're still doing good? Okay. I'm going to get this one. I'm going to move that just for a moment. And get this up in here. All right, I think I'm going to have to detach this other one. It's kind of in the way. But I'm going to hold your trach in place, and I won't let go of it until everything is as tight as it needs to be, everything is secure. Okay, so there is that, and I'm going to come around behind and grab this. All right, and that's the one I want to get next. Try and keep the oxygen nearby for a little blow-by. And I'm going to tighten this up. So I only want it to be, I want it to fit 2 fingers in there. Okay, so I want to, all right, yeah, that's pretty tight. And I can only fit 2 fingers in there. I'll put this back on you. But now I'm going to replace this, and then we will just about be done. Get this under here like so. That'll keep your skin from becoming bothered by things. All right, and so now I'm going to, I'll remove the towel, make sure that you're comfortable, and I'm going to get rid of all my materials, and I can put that in the dirty clothes basket. I'm going to take off my gloves, and I'm going to document everything I just did. And I want to get rid of everything and put the bed back to a comfortable position, or get it back to its right height, and make sure you've got your call light, and yeah, let me know if you need anything. All right, is that a good? Are you comfy? All right, good deal. All right, I'll get rid of all this and document. And have a good day.